my name is Huynh. I am a physical therapist at OptiMove Physical Therapy and Wellness, and I just wanted to introduce you to Sophie here. She's a 29-year-old D1 athlete, and because of that, she has experienced lots of trauma throughout her life, whether that be physical injuries or head injuries. And so one thing that we've been working on is returning to yoga, and let me show you a few things that we can do so that she doesn't have to increase her head pain or any of the symptoms that she's been experiencing. So let's start in a tabletop position. Just stack your shoulders over your wrists and your hips over your knees. And then stare in between your fingertips. One thing that we have to focus on is not introducing too many head movements, just because that can aggravate her symptoms. So let's just start with a cat-cow. We're gonna modify it a little bit. So inhale, cow pose, drop your belly, send your gaze forward rather than up. Exhale, cat pose, dome your upper back, press the floor away from you, gaze in between your hands. Okay. Inhale, cow pose, drop your belly. Exhale, cat pose, round your upper back. Draw your belly button up into your spine to engage your core. Okay, and we'll do this a few more times. Inhale, cow. Inhale, exhale, cat. And then on your next inhale, come back into a neutral tabletop. And then knit your front ribs in to engage your core a little more. This time, reach your right hand up and forward. And then if you feel steady, kick your left leg back for a bird dog. I'm gonna try to keep your hips stable here. And this will help engage her core as well as stimulate different parts of her brain, since we're working both sides. Okay. Inhale, reach a little farther. Exhale, come back down. Okay. This time, bring your left arm forward and your right leg back. For bird dog, good. Really press the floor away from you. Inhale, reach a little farther. Exhale, come back down. And then those are just a few simple things that you can do on the floor that's not going to aggravate any of your head movements. We can also modify doing lots of standing activities as well, but these are just a few floor modifications that I wanted to show.
So, Sophie, I know that, how long have you been a client of OptiMove Physical Therapy?
2 months.
And have we been able to work with some of your symptoms that you've had? It's okay.
We have. Yeah, y'all have a lot. I'm feeling significantly better in 2 months. And I do notice a lot of changing in my energy level. And yeah, my headaches have gone down, and I feel a big difference. And I also feel really good about knowing that we're addressing kind of like the fundamental thing that's causing some of my headaches to return. And this is something that hasn't been really brought to my attention. You know, in the past, going to lots of doctors and things, I had never been talked to about vestibular. So I feel really happy about addressing kind of one of these like fundamental things that might be causing things.
Awesome. Thank you.